Welcome to the State of Health. I'm your host, Karen Bowling, Cabinet Secretary of the West Virginia Department of Health and Human Resources. In today's show, we'll take a look at how an innovative program called Safe at Home West Virginia is revolutionizing how we help children with behavioral health needs. We'll also tell you about a program underway this month that provides families in need with vouchers to purchase back-to-school clothing for their kids. But first, a look at Safe at Home, a relatively new project aimed at keeping more at-risk kids with their families. In less than a year, this team approach is now expanding. Sarah Liu takes a look at the impact this technique has on one West Virginia family.
See, they're all nice and good.
For Rhonda McCormick, family is everything, but nothing prepared her for what followed after her son, Josh, was born.
He would bang his head on walls, floors, furniture. He would take toys and hit himself in the head with those.
Josh would climb curtains, throw clothes out of his drawer. Babysitters lasted about a week. Daycares didn't even last a week. At age 8, doctors discovered a brain injury that was present at birth, but more medicine didn't calm his disruptive and dangerous behavior. Rhonda was ready to place him in a residential treatment facility.
So when I called them and I said, I've got to place him, I can't do this. So the case manager that I was working with at the time, she said, let me try one more thing. We've got a new program coming out, and it's going to be here within the next week or so. Can you hold on?
Rhonda half-heartedly agreed to the one more thing. To her surprise, 2 carloads of people arrived at her home. 9 people came inside and got to work.
Something that nobody ever asked me was, what is he good at? What are his strengths? What does he like to do? What are the goals you have for him when he grows up? What are his goals? What do you want to see happen in the future? Those are questions nobody had ever asked.
The pilot program, conducted in a handful of counties at the time, was known as the Community-Based Treatment Team. The team provided services that allowed Rhonda time to be with her other children and even complete errands, while helping her son learn how to control his behaviors.
The first 3 months was very intense. I mean, that's when we had people come into the home every day, from the therapist to respite, his mentor coming in.
Sometime towards the end of the 9-month team intervention, Rhonda noticed something different.
We were getting along. I couldn't believe it. It was like, how did this happen? And it didn't happen overnight. It was a process.
Sadly, Josh passed away from cancer at the age of 22. For Rhonda, Josh at least got to realize he had a lot more to offer after being wrapped around the arms of the community-based treatment team.
It kept Josh home with us, with his family, and he never had to go residential. We had everybody that we needed right there.
For the State of Health, I'm Sarah Liu.
Today's Safe at Home program is modeled after the earlier community-based treatment team approach. Joining us to talk about Safe at Home West Virginia is Nancy Exline, Commissioner of the DHHR's Bureau for Children and Family. Nancy, thank you so much for being here.
Thank you, Secretary Bowling. It's a pleasure to be here to talk about Safe at Home.
I know both of us have spent a lot of time and energy on this program and feel strongly about it, but our viewers may not be familiar with the program. So could you tell our viewers a little bit about the program, how we got it started, and what we're doing to expand the program?
Certainly. In October of 2014, West Virginia had the opportunity and was selected to be a Title IV demonstration project. We were opened up to try to provide wraparound services to youth ages 12 to 17. And we opened that up in October of 15. We started our program in just 11 counties. Here in the Kanawha Valley and over in the Eastern Panhandle, we chose locations that we either had worked the past program in, or in the Eastern Panhandle where there needed to be some services out there, and that we utilized a lot of out-of-state placements. So we have been utilizing the National Wraparound Initiative. We have hired wraparound facilitators with our local coordinating agencies over this last several months, and we're getting ready to expand to 24 additional counties in August.
Now, we know this program is successful, and the reason it's successful is because we do want to keep children in their home and community. I mean, it's critical. I mean, when we remove children from their environment, we take them away from all the things they love and care about, and it's trauma for that particular child. I know we focused our attention on keeping children at home. Can you tell us a little bit about the number of children that we've been successful with in at least the initial rollout? Because I do think that's important for people to recognize that, you know, we're already being successful with this program,
Sure.
keeping people at home, children at home with their families or with kin or foster families or whatever we need to do to ensure they can stay in their community.
Just in those initial 11 counties, we've already had over 178 referrals. And those referrals, because our program looks at children that are already in an out-of-home placement or children that are at risk of going out of home. So of those 178 plus referrals, we've already had 50 that we've been able to maintain in their homes through preventive services using wraparound. We've already been able to bring 25 youth that were in state and residential. They've come home to their communities, and an additional 18 youth have come from out-of-state facilities and are back in their West Virginia communities, having services being helped by the wraparound facilitators and our local coordinating agencies. And for us, that's a huge impact in such a short amount of time.
It's very, very exciting. I believe it's so important. You know, I don't think people realize that, you know, the things that we're doing to prevent children from going out of home are very similar to the story that we just saw on the state of health, where there was a prevention, you know, that they were able to keep their child in their home because of the wraparound. Can you talk about what does wraparound mean? We talk about a wraparound facilitator. What are they doing in the home that helps keep children with their families or youth with their families in their homes?
Much like what you saw in that previous model, it starts out really very simple, sitting down with a family. And it may be their biological family or kinship, or it could even be a foster home, where you sit down and you develop with the wraparound facilitator, and our employees are there as well, our case managers, and they talk about the strengths that a family has and that a child has. And then you begin to develop an actual plan that is not a cookie cutter approach. It is exactly the needs of that family and that child. And that's what's unique. Whatever it takes to keep a child in the home, whatever it takes to help bring that family together, those are the fundamentals of a wraparound plan that says to that child, what do you need? What will help you? And you know, one of the principles of wraparound is looking at what the family wants. Family first, family choice. Being able to do that, and that's a very different model than what we've utilized in the past at looking at the real needs of a child individually and not what is a cookie cutter approach.
And I think that's an important consideration. I mean, we know that, you know, all of our children and youth are different. Their personalities are different. Their needs are different. You know, picking them up and sticking them in, you know, where they're either in a program that doesn't really meet their needs. When they get out of that program, what's likely to happen to that child?
What's likely to happen to that child is that they end back up in the system. When we take them out, they go to families that really aren't prepared for them, or they're not prepared for their families. So coming together and engaging both the children, the youth, and their families prepares for a more stable, a better success for the children and the family as a whole. So it's just a very different model. Something that's different.
You know, I've been very impressed with our partners. I mean, we've had a lot of people across our state embrace the concept of keeping kids in their home communities, of not taking them away from, you know, the people that they care about, ensuring there's a loving adult in their lives. What do our partners do for us, and how important is that to the success when we roll this out in the additional counties?
Those local coordinating agencies are everything to this project. The way in which they look at not just counseling and mentoring services, but the way that they have engaged the communities. They are looking for those types of services that can't be bought. They're things that are very important, looking at local YMCAs, looking at other churches, and ways in which kids and families can connect to each other. It doesn't cost anything. It's just what helps families move forward.
You know, I think we're all about family in West Virginia, and we're all about children, and I think this project is a perfect example of how we can continue on that pathway across the rest of the state of West Virginia as we roll out the project. Thank you for sharing with us.
Thank you.
Still to come, it truly does take a village to heal a family in turmoil. We'll talk with one of the program's partners about its approach. Stay with us.